Welcome to this video on ECG review. Let's review the normal values and hints for key components of a standard ECG, including P-wave, PQ interval, QRS duration, QT-QTC, T-wave, heart rate, and frontal axis. The causes of ST elevations are numerous and include acute myocardial infarction, coronary vasospasm, pericarditis, and benign early repolarization, among others. Causes of ST depression involve myocardial ischemia, reciprocal change in STEMI, posterior myocardial infarction, and certain drug effects like digoxin toxicity. This slide compares the ECG findings in acute pericarditis, labeled A, with those of early repolarization, labeled B. An ST/T ratio greater than 0.25 is suggestive of acute pericarditis rather than early repolarization. The diagram illustrates how these segments are measured. Key differentiators between acute pericarditis and early repolarization include an ST/T ratio above 0.25 for AP and the resolution of changes on a repeat ECG after 3 months in AP. Early repolarization is a common finding, seen in up to 18% of healthy young adults. In atrial fibrillation, the impulse's random penetration through the AV node causes haphazardly irregular RR intervals. However, at a very fast ventricular rate, this irregularity may be difficult to discern, leading to pseudo-regularization. This tracing is an example of atrial fibrillation with a rapid ventricular response, which should not be confused with PSVT. Atrial fibrillation with a regularized ventricular response can be seen in cases of complete heart block, during sustained ventricular pacing, or with certain cases of digoxin toxicity. This is a blank slide. Differentiating between SVT and VT relies on features such as atrioventricular relationship, QRS duration, QRS axis, and specific QRS patterns in precordial leads. This is a blank slide. 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 This is a blank slide.